the first step for this Otic administration is to check for the doctor's order to verify if you have the correct if to verify the correct dosage, the indication, the route, the drug name, and so on, and to promote patient safety. So I have here, let's say, the doctor's order. Okay. Once that has been verified, you can now proceed with the hand washing. So after hand washing, assemble the equipments that you will be needing. So I have here my eardrops, or the medication that I will be using, and a pair of clean gloves. Okay, so first is to don on the clean gloves. So next is to warm the medication with the palm of your hand, because instilling cold medication may result in vertigo or nausea. So warming it up. Then while you are warming it up, position your patient where their affected ear is facing upwards. So this is to provide sufficient access for the administration of the medication. So since the affected ear of my patient is on the left side, so I will be positioning my client right here. Okay. Then restrain your patient if necessary. Now that is done, I'm gonna be cleaning the pinna and the meatus of the ear using a tissue that has been twizzled or twisted. So I forgot this is one of the materials that you will be needing. So first is to twist the tissue and clean the discharge of the ear. So cleaning the discharge of the ear will help improve the penetration of the medication. So cleaning the discharge, then discard, and then straighten the ear canal. So to straighten the ear canal, my patient right here is about 3 years old, so I'm gonna pull the pinna up and back to straighten the ear canal, so that I will have a much more better access to the deeper structures of the ear. So straighten the ear canal. I will warm it up first. Then instill the correct number of drops. When administering the medication, make sure not to touch the end of the dropper or the end of the medication to the ear of the patient, because it can result to contamination of the medication. So pulling the pinna up and back, so up and back. Then instill the correct number of drops, 1, 2, 3, based on the client's chart. Then gently press on the tragus of the ear to assist in the flow of the medication. And then if prescribed or desired by the patient, take a cotton ball soaked with the medication and place it or insert it in the auditory canal of the client, so that it would prevent the medication from draining out. Well, but if not, have the patient assume this position or hold this position for about 5 minutes, so that the medication will not flow out of the ear. So while the patient is holding that for 5 minutes, you can dispose the used supplies that you have used, which I have already done so. And then remove or doff the gloves and perform hand washing. Dispose. And then, after doing so, document the date, the time, the the route of administration, as well as the patient's response, because proper documentation or accurate documentation will ensure patient safety. That is all. Thank you.